By the end of this video, you'll know the 7 biggest Creighton mistakes that keep Catholic women stuck in confusion instead of confident in their cycles. Let's make sure you're not one of them. I'm Cristy from Blue Veil Wellness, and I'm a nurse practitioner, NaPro medical consultant, and trained in Creighton fertility care. I've been charting my cycles for years, and now I help other women navigate their Creighton journey. The Creighton Model is incredibly powerful for understanding your fertility and your overall health. But here's what happens. Women come in motivated and ready, and then somewhere between the intro session and cycle 3, things quietly fall apart. Today, I'm going to save you from the 7 mistakes that trip up almost everyone so you can actually stick with Creighton long enough to see what it can do for you. So let's start with mistake number 1. Not recording your findings somewhere. And I mean anywhere. I've worked with women who try to keep everything in their head. They think they'll remember what they observed this morning by bedtime. They won't. Others record sporadically. Maybe they write it down on Monday and Tuesday, and then life gets busy and suddenly it's Friday and they're trying to reconstruct the week from memory. Here's the thing. Your memory will lie to you about your cycle. But here's the bigger problem. Creighton is all about pattern recognition. Your practitioner needs to see trends over time, and you need to see your own patterns emerging. When you're missing days or guessing at observations, you're not just missing the data, you're missing the whole point. Your chart becomes useless for identifying things like low progesterone patterns, anovulatory cycles, or early signs of reproductive health issues. That fix is simple. Record every single bathroom observation, every single day in real time. Not later, not when you remember, but right then. Even if it's just a simple post-it note, a notebook, your notes app, as long as you have it noted somewhere. Later in the day, you can look back and then make your decisions to put on your actual chart. So mistake number 2 is the flip side, overanalyzing every single observation. This is where women get so focused on the details that they lose sight of the big picture. And I see this all the time. A woman notices her mucus looks slightly different today than yesterday, and she spends 20 minutes staring at it, trying to decode what it means. She's texting her practitioner about every little variation, asking, is this HCS or 10KL, when honestly, the difference doesn't change her fertility status. And here's what happens. You get so caught up in perfecting every single day that you miss your overall pattern. Creighton is about recognizing your peak day and your fertile window. It's about seeing trends over cycles, not obsessing over individual observations. The other problem, this analysis paralysis, makes charting stressful instead of empowering. You start dreading going to the bathroom because you know you're going to have to make another decision about what you're seeing. So the fix is learning to observe and record without judgment. Your job is to notice and note. Your practitioner's job is to interpret patterns. Trust the process and stop trying to be your own fertility detective. Mistake number 3. So skipping the evening observation. I get it. By evening, you're tired, you're focused on dinner and bedtime routines, and the last thing you want is to think about your mucus. But here's why this matters. Your mucus can change throughout the day. You might have nothing in the morning, then by evening, you're seeing clear, stretchy mucus that indicates fertility. And if you skip that evening check, you're missing critical information about your fertile window. I've had clients who thought they had literally short fertile phase, when actually they were just missing half their observations. They were making family planning decisions based on incomplete data, which is exactly what we don't want with Creighton. The evening observation doesn't have to be complicated. You're not looking for a full analysis. You're just checking in. Is there mucus? What does it look like? Record it and move on. Remember, Creighton works when you work with it consistently. Every observation matters, morning and evening, because your fertility doesn't take breaks, just because you're busy. So mistake number 4 is not learning your personal pattern first. This is where women jump straight into family planning mode without actually understanding what their normal cycles look like. I see this especially with newlyweds or women coming off of hormonal birth control. They want to know immediately, can I get pregnant today? Am I safe today? But they haven't taken the time to learn what their individual cycle actually does. So here's the thing. Every woman's pattern is different. Some women have a really obvious mucus buildup to peak day, others have more subtle changes. Some have longer post-peak phases, others shorter. You need to know your pattern before you can make confident family planning decisions. When you skip this learning phase, you end up guessing instead of knowing. You might avoid intimacy when you're actually infertile, or think you're safe when you're actually approaching peak day. The Creighton method gives you 3 full cycles to learn your pattern for a reason. Use them. Don't rush into family planning mode until you can look at your chart and say, yes, this is what my cycle normally does. Your confidence and your family planning decisions will be so much stronger when you know your own normal. By the way, I'd love to hear from you in the comments about this, because I know so many of you are walking this Creighton journey right now. Mistake number 5, ignoring premenstrual spotting. A lot of women think brown bleeding before their period is just normal, so they either don't record it or they brush it off as just my body getting ready for my period. But here's what you need to know. Premenstrual spotting can be a sign of low progesterone, and low progesterone affects your ability to conceive and maintain a pregnancy. This is exactly the kind of pattern that NaPro technology can catch early. I've worked with women who had been spotting for days before their period, for years, and no one ever told them that it mattered. They thought it was just how their body worked. But when we looked at their charts, we could see a clear pattern that pointed to hormonal imbalance that we can address. The other issue is that spotting can confuse your fertile window calculations. If you're not recording properly, you might miss your true peak day or make incorrect family planning decisions. So record everything, even the brown bleeding. Actually, especially the brown bleeding, even if it seems insignificant. Your chart is telling a story about your reproductive health, and every detail matters for getting the full picture. Mistake number 6, rushing through your learning phase. I see this especially with women who are eager to start using Creighton for family planning, or who feel frustrated that it's taken so long to understand their cycles. Here's what happens. They attend their introductory session, maybe 1 or 2 follow-ups, and then they decide they've got it figured out. They stop meeting with their practitioner and start making family planning decisions based on what they think they know. But Creighton has a structured learning timeline for a reason. It typically takes 3 to 6 cycles to really understand your personal pattern, because we have to account for stress and life changes. So your practitioner is trained to spot things that you might miss, subtle patterns, unusual variations, or signs that something needs medical attention. I've had clients who thought they were graduating after 2 cycles, only to realize that months later, they were misinterpreting their mucus or missing important health indicators. By then, they'd either had an unplanned pregnancy or missed months of data that could have helped identify a reproductive health issue. The learning phase isn't a hurdle to get over. It's the foundation that makes everything else work. So stick with your practitioner through the full learning process. And trust me, the confidence you'll have afterward is worth every follow-up appointment. Mistake number 7. The biggest one is not working with a qualified practitioner. This is where women try to learn Creighton from YouTube videos, books, or apps, thinking they can teach themselves. Here's the truth. Creighton is not a DIY method. It requires proper training from a certified fertility care practitioner who has gone through an extensive education to teach this method correctly. There are nuances and subtleties that you cannot learn from a video or a book.